Well, I think it's important to realise that both operations work predominantly by restriction. So that's decreasing the effective size of the stomach so that the portions you can take are smaller. The gastric bypass also has an additional benefit of bypassing part of the stomach and the first part of the small intestine, which never see food. So we also have a component of malabsorption. We don't absorb calories in the same way that we previously did.
So they're both operations that are done with keyhole surgery under a general anaesthetic, so you put to sleep. You don't do this with spine or with epidural. The operations are a little bit different in terms of length. So the gastric bypass is a bigger operation. It usually takes about an hour and a half to 2 hours, whereas a sleeve gastrectomy is a shorter operation, maybe an hour of time in the operating theatre. But with either operation, you're usually looking at 2 nights in hospital afterwards and about 2 weeks of recovery after the operation before you can get back into your normal activities. In terms of absolute differences between the operations, the sleeve is a far easier operation to get your head around because there's no replumbing of the intestine. It's a more straightforward narrowing of the stomach where about 80 to 90% of the stomach is removed, and you move the stomach from a reasonably capacious sac, effectively, to a narrow tube. The gastric bypass, on the other hand, reduces the size of the stomach that you're eating into. We make a small pouch from the stomach, and that's separated from the rest of the stomach, but we join that pouch onto the small bowel. So the stomach isn't removed in a gastric bypass, but it is bypassed, so the food no longer goes into the majority of the stomach. So again, both of those operations are done with keyhole surgery. They both reduce the size of your stomach. They both affect hormones and chemicals that influence your appetite and how you process food. But the anatomy, how the operations look, is quite different.
Weight loss surgery is very safe, and it's got a lot safer over the last probably 10 or 15 years. So it's safer than hip replacement surgery, it's safer than gallbladder surgery, it's safer than coronary artery surgery, safer than a lot of other elective operations that are done.
We've seen many other fads come and go in surgery. Today our practice is predominantly gastric bypass versus sleeve gastrectomy. Gastric bypass, because it stood the test of time, we consider that the Rolls Royce to which we compare all other weight loss surgeries. And sleeve gastrectomy, because it's easy to understand how it works, it's easier to perform, and it's very well tolerated by patients.